Hello friends, welcome to the Retina Imaging channel. This is the part 2 of our previous video called New Lexicon, Dry AMD. After having explained iRORA in the part 1, we are going to see what are the defining features of iRORA. iRORA means incomplete RPE and outer retinal atrophy. As the name suggests, the extent of atrophy in iRORA is less than iRORA. The loss of RPE band and choroidal hypertransmission are less than 250 micron in size. Like iRORA, overlying photoreceptor degeneration is integral part of iRORA as well. These changes are loss of ELM and EZ, thinning of outer nuclear layer or ONL, subsidence of inner nuclear layer and outer plexiform layers and hyporeflective wedges in Henle fiber layer. Let us see an example of iRORA in this OCT line scan. There are bumpy RPE elevations due to drusen. The area of interest has been highlighted with red marker. There is absence of RPE band marked on the left side of the image. The choroidal hypertransmission is seen as white streak over the choroid and sclera posteriorly. At the right side, as we trace the ONL towards the area of RPE disruption, we see that it is gradually narrowed down. The hyperreflective line above the ONL, which is outer plexiform layer, tends to dip down towards the area of RPE disruption. And so does the overlying inner nuclear layer. This is what is called the subsidence of INL and OPL. If we look carefully, we will see that there are hyporeflective wedge-shaped spaces in the Henle fiber layer on both sides of subsiding OPL, sandwiched between OPL and ONL. Here is another example of iRORA. The area of interest is marked by red markers. We can see that there is a gap in the RPE band. Faint choroidal hypertransmission is seen posteriorly. The INL and OPL can be seen dipping towards the absent RPE band. ONL is also thinned out as it approaches area of absent RPE band. A hyporeflective wedge on the side of subsiding OPL is located in the Henle fiber layer. So this is another example of iRORA. We need to note that, like iRORA, there should not be any RPE rip in iRORA, and iRORA, by definition, may be present with or without choroidal neovascularization. Now the next question is that where does the term nascent GA fits into this classification system? Nascent GA was defined as precursor of geographic atrophy. It is an OCT feature and comprises of either of these two findings, subsidence of INL and OPL and hyporeflective wedge in Henle fiber layer, in a setting of dry AMD. Let us see a case of nascent GA. We can see that INL and OPL are dipping down towards outer retina and hyporeflective wedge is present in Henle fiber layer. This OCT line scan shows nascent GA as a part of iRORA. There are subsidence of INL and OPL along with hyporeflective wedge in HFL. At this point, if we revisit the diagnostic criteria of iRORA, we realize that diagnostic criteria of nascent GA are part of diagnostic criteria of iRORA. It means that nascent GA can be considered as a part of iRORA without giving consideration to RPE features of later. Most nascent GA will qualify as or eventually lead to iRORA or even iRORA. However, when we talk about nascent GA, it is always in an absence of CNVM in same eye. Whereas iRORA and iRORA are defined irrespective of presence or absence of CNVM. So friends, this was all about new terms in dry AMD. As newer therapeutic modalities are being evaluated for management of dry AMD, understanding these terms are vital. We hope that this presentation of TRIC was useful. Please do share it and don't forget to subscribe to our channel. See you in our next video.